Morning, everybody. So we're going live here with Jamie McAnally, who is the general manager of Turks and Caicos Beaches Resort, which is, in my opinion, the best family resort in Turks and Caicos for sure, but best resort for families, great child care, things to do for little ones, teenagers, and plenty of opportunity for fun for parents. So, just wanted to sit down. Jamie was nice to sit down and do a quick Q&A with us. And first of all, how long have you been here?
I've been here for almost 9 years.
Can you take your mask off?
I'm not allowed to take it off.
You're not?
No.
Okay.
I'll sit here, but just with the spacing, I've got to keep it on if that's okay with you. Can you hear me?
Yeah, can you
Okay.
hear?
Can you hear me?
Okay, great. So, are you okay with my mask off?
Absolutely.
Okay.
Yes, ma'am.
So, you've been here how many years?
So 9. Super Bowl Sunday makes 9 years. That's when I came here.
Oh, okay.
So I always can easily remember that.
Okay, so I was a little bit before my time. I brought my kids here 12 years ago.
Did you?
To this resort, yeah. They were 1 and 4.
Yeah.
They're now 14 and 17. Last night I talked to my son Reed, who told me specifically he remembered the Xbox room, the water park, and the Superman ice cream.
Yeah.
At, what's the name of the restaurant?
Bobby D's,
Bobby
maybe?
D's.
Yeah,
Superman
Bobby D's.
ice cream at Bobby D's
Yeah.
was his #1 memory.
Absolutely.
So, anyway, I get a lot of questions from people all the time about how we can travel, when we can travel, what it looks like. So you guys were nice enough to bring us down here so we could just actually show people what it looks like to travel.
Yeah.
Don't take my word for it, and I'm not going to try to convince you to travel, but I can show you what it means, and we can answer questions. So, some questions came in over the last couple days, and we're just going to draw out of a hat. Jamie has very little preparation for this, but hopefully has the answers. Here we go. Number 1, what happens if someone in my family tests positive for COVID while on vacation?
Sure, that's a good question. You know, the island is taking a lot of precautions, maybe more so than some other destinations. So there's protocols that are in place from the Ministry of Health, and we follow those guidelines to make sure that the staff is safe and all the visitors coming to Turks and Caicos are safe. So, you know, you have the PCR test that you have to take 5 days prior.
Yep.
So that's a good gatekeeper to begin with. But let's say for some reason that a guest was to test positive. A couple things that we put in place here at the resort is we've try to limit the amount of traffic through the nurses station. So they all get a letter when they check in to let them know that there's an interview process to make sure that, a nurse, and we have a nurse on property and we have doctors on property as well. So we do interviews via telephone or via Zoom as it is to make sure that if they have symptoms or so on that can be diagnosed. And then if indeed somebody has a symptom that looks like it would fall into that COVID-19 category, then what we would do is we would contact the Ministry of Health and they would do a swab, just like they did for their test before they came here. And then they would be isolated to their room until they would then get those swab or those test results back.
So the Ministry of Health comes to do the swab at the resort?
They would, yeah.
Okay.
So we can do swabs here, which is another question that maybe you'll ask me or maybe not, but I'll throw it out there a little bit later.
Okay.
But yes, Ministry of Health would come here, they would take the swab, and then the guests would be isolated to their room.
How long is it taking for you to get those results back right
So
now?
the results from the Ministry of Health are usually between 24 to 48 hours is what it is before they get the results back. If they indeed were positive, okay, then they would be on a quarantine, and the guests would then have to quarantine at the resort.
For 2 weeks?
For 2 weeks is a typical quarantine period, correct. If for some reason that the positive case was to then develop into a medical sort of emergency, as it would be, the insurance policy that the company has purchased for all guests coming in would cover for an evacuation of that guest to go back home.
Really?
Yes. If they did not, though, and again, that's for an emergency sort of situation where, hey, I need to go to the hospital and so on. With
Back
this,
to the States
back
or
to
anywhere?
the States.
Okay.
Yep. And then, but if they were, again, asymptomatic, or let's say they didn't have that, then they would be under that quarantine for 14 days at the resort. Again, you still have the insurance policy that would certainly cover any extra stay-on expenses as it would be for that time period. But we would take care of the guests, while they're in isolation. We provide food and beverage and care and games and snacks and everything to make that guest feel
Sort of
comfortable while they're
like
here.
butler level service
Butler
that would
level
bring
service,
things to the
but
room.
they would be quarantined to their room and they would have to stay in the room.
Their room, and they would they have to relocate to a different part of the resort?
What we would do is relocate them into an area that we've designated as our isolation area.
Okay.
But it's still, again, you're still getting service there in that room. Yeah.
And just so you know, in order to complete the documentation for the Turks and Caicos, you're required to prove you have health insurance that would cover COVID.
Yep.
So it sounds like you would wind up with good, solid double coverage.
Correct.
So.
And what we are seeing, again, I don't know if this is a question, but some areas where visitors are coming in, they're having to take PCR tests to go back home.
That was my next question.
Yep. We have that capability through our nurses station, so we don't go through typically the Ministry of Health for that because it's not a medical emergency sort of
Right.
scenario.
Right.
But we can get the test done here on property, and then we use a private lab that's here on island, and we usually get those test results between 12 to 24 hours, actually a little bit quicker.
Okay, good to know.
Yep.
Thank you. All
You're
right,
welcome.
moving on. Mike from Oxford wants to know, what's the best song that mentions the Turks and Caicos?
I would have to say, welcome to the islands, the Turks and Caicos Islands. We do a full production of this song every Wednesday at our cultural night at the stage.
So you're not going to
And
sing for
I
us
will
now?
not sing it because that's as far as I know. Other than there's some dance moves that I could show you, but you didn't request that, so I'm sorry. Emily.
Sorry, Mike.
You're getting gypped.
Ask the question next time, Mike. Okay. When can my family go? Asks Kelly. She has 2 young children in school
Yeah.
that right now are on virtual school.
Yeah.
So when
Now's
can
a
they
great
go?
time. Now is a great time. I was doing my tour around the property this morning, and I saw a young lady, probably teenager, maybe a little bit earlier, sitting at Cabana this morning on her laptop, and she had the Zoom meeting on, and she had all the classmates on her laptop. So
I think I saw a first grader doing that yesterday afternoon.
yeah,
And so the bottom line is you can go, nobody's stopping you. You have to jump through some hoops, but it's just like being at home where you just have to take personal responsibility for your own safety. I don't feel any more or less safe here than I do at home. And they say that the 2 most common places that you can get COVID is the grocery store and a bar or restaurant. There's no grocery store here, so thank goodness for that. But with low occupancy, like a lot of resorts in the world right now, there is a lot of space everywhere. So it's up to everybody whenever they feel ready, but I don't feel any more or less safe here than I would anywhere else I would go because I take my own precautions, I think.
yeah, and I'm sure we'll speak to the protocols that we have in place. But when you say less or more in certain bar sort of scenarios, right, that maybe you see in nightclubs and so on. We've implemented physical distancing rules. We've implemented sanitization rules. We've implemented obviously higher cleaning procedures. All of our staff have masks on and so on. And we've actually required in confined spaces that the guests would wear masks as well. Now we don't make the guests obviously wear a mask when they're dining.
Right.
But to go into the club area at night, we're asking people to wear the mask in those kind of scenarios, just again for the safety of everybody.
So something I notice is that your employees are very strictly wearing them, and that's really appreciated. What do you do in the event that one of your staff members tests positive?
So if we have a team member test positive, thank you. Again, we follow the Ministry of Health guidelines as it would be. What we've done with our staff is to make sure that they have gotten that information for the last 9 months. As far as if you have a symptoms, then you need to stay home. Stay home and contact the Ministry of Health hotline so that they can then evaluate and see if you need to be tested and so on. If a team member is tested positive, again, they would be isolated and quarantined at their home, and then they would be required to provide a document from the Ministry of Health to say, hey, I'm now tested negative and I don't have the virus.
A tough question is, have you had that experience? I know only having been open for about 2 weeks, have you had that yet?
Well, over the duration of the time period, yeah, we have, but we're the largest employer on the island as well. We employ over 1,600 people in an island that only has 30,000 people in it. So
in reality, it's
in
going to
reality,
happen.
again, it's going to happen. And let's remember, as you said, this is everywhere, right? It's
Yeah.
not just at work. It's going to be at home, in church, at the grocery store, and different social scenarios. So the best thing that we can do is to learn to live with it and do the precautions that we have and take them and do them in our personal lives as well.
Right.
And again, we're taking temperatures of all of our team members when they come into work every single day.
Every day.
Every single day that
Wow.
they come in, and they actually get their temperature taken before they leave for the day.
Wow.
So let's say that somebody, again, doesn't feel well or has it, then boom, we can act very quickly and implement the protocols that we have in place.
Good. Okay. What would you say is the number one? Oh, so we just covered that to mitigate risk. Number one thing. We covered that. The whole collection of protocols.
Yeah.
Is working.
The platinum protocols, and we've got a very detailed list on our website that people can go to and they can click on, and they can list you out. I mean, the 18 touch points in the room. I mean, from arrival to departure. The things that we kind of briefly touched about. With the dining reservation systems and what we have in place. And one of the things that I talked about masks being in confined spaces, and if we have guests that let's say they forgot their mask in their room and they want to come in, I've got some disposable masks that we can say, would you mind please putting this on as you come in to shop in the resort shop, or as it would be. And the guests have been extremely cooperative.
Good.
I mean, what else are you going to do? You got the sunshine, you can be on the beach, and
right.
you got to wear a mask for a little bit.
So you mentioned restaurants. A woman I know with 3 kids who lived outside of New York City, and like a lot of people decided to make the move to a rural area to sort of get out of that more crowded area. She asked me, what is it like to be in the restaurants? Because that would be her number one thing. She doesn't want to take her family to a restaurant 3 times a day for meals.
Yeah.
So one of the things I've been trying to explore is, what is it actually like to eat in a restaurant? So at home we have mandates for capacity and hours that restaurants have to shut down and stuff. So can you just briefly
Sure.
touch on how you handle that?
So we followed those mandates as well. So we've reduced the seating capacity in the restaurants. And then what we've done, we've got 21 restaurants as well to start with. So what's nice is that you have a variety of places that you can go each and every day and spread out the occupancy amongst those restaurants. We've reduced the number of buffet restaurants because I know sometimes that gets to be a concern with guests. So we've reduced the number of buffets we have, but we've also implemented protocols in those buffet restaurants so that guests don't ever touch an item other than their own plate. They're handed their own plate, they go up to get the food, we serve the food onto the plate, so nobody's touching a tongue, there's no shared utensils in that buffet. And then through the cleaning protocols and the seating capacity rotations, you have fewer people in the restaurants to start with, and then again, full sanitization every single, in between table seatings. We're using hospital grade, if you will, sanitizers on the tables that then they have to sit for 15 minutes, and then boom, that table's set to go
Great.
for the next guest.
Okay. Alan would like to know, is Jomo still here?
Alan, yes, Jomo is still here. He still runs the Riviera Pool Bar at French Village.
Okay,
Yep,
and what's
he's there
his
every day.
specialty? Because I'll go see him today.
Jomo is just special all around. All around. whatever the special of the day is, Jomo. I mean, our team, again, we've got a great facility here, but nobody beats the resort team here.
Yeah.
The memories and the relationships that they've developed with our guests over the years, like Alan says, he remembers Jomo more than he probably remembers the water slide, because he's getting fantastic service and personal service, and that hasn't changed.
Right. Alan probably did the water slide after seeing Jomo. Okay, so the number one question I think you're asked is about protocols, but what is the number one question you would ask of guests?
So, the protocols are certainly the number one question because of the safety concerns, right? And I would say that, again, the resort is safe, probably safer than their home or different areas, around the world as it is, for what we put in place and what we, I have a committee, a platinum protocol committee spread across the resort just to make sure that the protocols are being safe. But then,
So if I follow up on that, sorry to interrupt you,
Yeah.
I think are getting really tired of words like unprecedented and challenging and
Yeah.
protocol, and so really specifically, what would you say? Gosh, people just do this.
yeah,
What would
so
it be?
let's just start in housekeeping per se, right? So we would always clean the room very thoroughly with our chemicals and so on that we would have in the room. But We've now included steam cleaners inside on the tile floors. We're including sheet and inspections on the sheets, linens that we're changing every day.
UV lights.
UV lights, right? We never really, the supervisor might carry that, but now we've got that on every single room that we inspect.
Honestly,
Not only
I
the
hope
sheet,
that never goes away.
right? Yeah, but
If
again,
you've watched 48 Hours.
you know, and that's the thing, right? But like the remote control and those hard surfaces and
Yeah.
things like that, those are being inspected even more closely. After that, there's a 3-step process that then you have a supervisor that comes in, and before a new guest arrives, that door is inspected and then sealed. And so you don't have a bellman going in, you don't have the refrigerator stopper going in after, you know, that room has been inspected closely. So now you know that you're the first guest into that room after that's happened. You know, our dive shop, I mean, here for the water sports, things that specifically speak to this is you go out on a Hobie Cat, right? And after you go out on that Hobie Cat is going to be clean and sanitized before the next guest gets onto it. That would be something that wouldn't have happened in
Yeah.
the past, right? Or that kayak or whatever it might be. So those are the specific things that we're certainly doing.
Okay. But what would you want me as a guest to do?
I would just want you to be, you know, cooperative, I guess is the biggest word, you know, as it is. We're all doing what we can, and so listen, you're here to have fun, and we're going to provide a wonderful vacation experience that many people have been looking forward to for 9, 10, 12 months as it is, have being cooped up. So when you come, again, if the lady asks you to please put on a mask before you go into the resort shop, we would ask you to wear the
do it.
mask when you go in, right? And so if everybody kind of follows the same guidelines that we're here, then it's going to be a safe and wonderful vacation, right? And we're not asking you to wear the mask on the beach. We're not asking you to wear it when you're sitting by the pool. We're not asking you to wear it when you're, you know, having a drink or having a meal, as it would be. But as you get up and you go and you're going into an area that may have other guests or certainly staff around, if you have that with you and you drop it in for a few minutes, that helps.
Okay.
It just helps.
Okay.
Yeah.
Well, thanks so much for your time, Jamie,
Pleasure.
and hope to see you again soon. If anybody else has questions for Jamie, I know I can pass them on by email or certainly to me. So shoot me a message and we'll keep talking about it. Bye, guys.
Bye-bye.